Welcome to today's Explainer. We're diving straight into the stark, honestly pretty terrifying realities and the incredible life-saving protocols surrounding the rabies virus. We're going to break down a disease that has quite literally terrified humanity for centuries. We'll unpack the science of how it works, how it spreads, and most importantly, how we can completely stop it in its tracks before it's too late.
Okay, so here's our roadmap for today. We're covering 5 key areas. Number 1, the 100% paradox. 2, anatomy of an infection. 3, the point of no return. 4, the survival protocol. And finally, 5, eradicating a global killer. Let's jump right in.
Starting with Section 1, the 100% paradox.
So here is the absolute defining paradox of rabies, and it all revolves around the number 100. This virus is nearly 100% fatal once clinical symptoms actually appear. I mean, there's practically no cure once the virus truly takes hold in the body. But on the exact flip side of that coin, it is also nearly 100% preventable, provided you take immediate, proper action right after an exposure. This wild paradox is exactly why understanding rabies is absolutely crucial. It's a literal race against a ticking clock, and in this case, knowledge directly equals survival.
To really understand what we're up against, we need to look at the virology. The rabies virus is this very distinct, bullet-shaped RNA virus from the Lyssavirus genus. And that bullet-like structure, it's covered in these specialized glycoproteins that act almost like microscopic lockpicks. They allow the virus to aggressively target and bind directly to human nerve tissue. And that's what paves the way for it to invade your central nervous system, meaning your brain and your spinal cord.
Now, while dogs are responsible for the vast majority of human rabies deaths across the globe, other mammals are heavily involved depending on where you happen to live. We're talking bats, foxes, wolves, raccoons, skunks. They all serve as common reservoirs for the virus. But here's a really important distinction. You will never, ever catch rabies from a bird, a reptile, a fish, or something like a mosquito bite. No way. The virus strictly requires a mammalian host to survive and pass on.
Moving on to Section 2, anatomy of an infection.
So how does this actually work inside the body? Well, the infection operates like a stealthy, ticking clock across a few sequential stages. First, an animal bite introduces the virus through its saliva. But here's the thing. It doesn't just immediately rush into your bloodstream. No. Instead, in Step 2, it quietly multiplies in the local muscle tissue right near the bite. Then, Step 3, it finds its way into your peripheral nerves. Step 4 is where it gets truly sinister. It uses what's called axonal transport to slowly, deliberately crawl up your nervous system toward your spinal cord. Step 5 is the major breach. It hits the brain, causing severe inflammation, or encephalitis. And finally, in Step 6, it spreads outward to the salivary glands, and this is exactly when those deadly clinical symptoms finally show up.
Now, because of the physical way the virus travels up those nerves, the incubation period can actually vary wildly, and this timeline is your one and only window for survival. The typical incubation window is somewhere between 1 to 3 months. But consider the extremes here. If a bite happens on the face, neck, or hands, the physical distance to the brain is just much shorter, right? So the virus can strike in mere days. Conversely, in very rare cases, the onset can be delayed for over a whole year. Basically, the location and the severity of the bite completely dictate how fast that clock is ticking down.
All right, Section 3, the point of no return. Once we hit this stage, there are 2 distinct ways the disease manifests. Most of us probably picture what's called furious rabies. That's the one characterized by severe agitation, hyperactivity, and those truly terrifying symptoms like hydrophobia, which is an intense fear of water, and aerophobia, a fear of air drafts caused by excruciating muscle spasms in the throat. But there's a second type you might not know about, paralytic rabies. This form doesn't have that dramatic agitation. Instead, it shows up as progressive muscle weakness and paralysis. Because it is so quiet and gradual, it's dangerously easy for medical professionals to misdiagnose it until it is simply far too late.
But before those severe neurological stages even hit, patients go through what's called the prodromal phase. These early warning signs are tricky because they look deceptively like a normal flu. Fever, headache, fatigue, loss of appetite. But there is one highly specific red flag to watch for, an intense, tingling, pain, or itching right at the site of the original bite wound, even if it's already healed. When you combine that localized nerve pain with sudden anxiety, it is a massive indicator that the virus has officially begun its active assault on the nervous system.
Let's pivot to Section 4, the survival protocol.
Understanding the World Health Organization's exposure guidelines is literally a matter of life and death.
This set of guidelines dictates the exact medical response you need based on the type of contact you had. So Category 1 is just touching or feeding an animal, or maybe it licks your intact skin. Good news, no medical intervention is required there. Category 2 involves minor scratches without any bleeding. This one requires the rabies vaccination series. But Category 3? This is critical. This includes single or multiple bites, deep scratches, getting saliva on broken skin, or honestly any exposure to a bat. This scenario demands the full arsenal: immediate wound care, the vaccine, and something called RIG.
So put yourself in this situation for a second. Imagine a highly stressful scenario where a child gets bitten by a stray dog, or a traveler wakes up and finds a bat in their tent. Before you even get to the hospital, what is the absolute first thing you must do to defend yourself against that 100% fatality rate?
The immediate first aid response might actually sound too simple to stop such a deadly virus, but step 1 is to vigorously wash the wound with plain soap and running water for a full 15 straight minutes. This physically flushes the virus right out of the tissue. It's incredibly effective. Step 2, apply povidone iodine or a similar antiseptic. Step 3, whatever you do not tightly stitch or close the wound unless it's medically necessary, because doing that can actually trap the virus inside. And finally, step 4 is to seek urgent, immediate medical care so you can begin your vaccine series.
Once you do get to the hospital for a severe Category 3 exposure, they're going to administer Rabies Immunoglobulin, or RIG. Now, RIG consists of either human or equine antibodies that are literally injected directly into and around the wound site. Think of RIG as an immediate biological bridge. The rabies vaccine itself takes a little time to teach your immune system to fight back, so RIG steps in to provide instant, localized protection, neutralizing the virus in the muscle before it ever gets the chance to enter your nerves.
The big takeaway here is that post-exposure prophylaxis, the wound washing, the vaccine, and the RIG absolutely saves lives. But, and this is a massive but, it only works if it's administered before symptoms begin. This treatment is incredibly safe and necessary for everyone. And yes, that includes pregnant women and young children. Completing the full timely vaccine schedule without a single delay is totally non-negotiable.
Which brings us to our final section, Section 5, Eradicating a Global Killer.
Because honestly, eliminating human rabies isn't just about treating the bites after the fact. It's about stopping those bites from happening in the first place. According to major health organizations, eliminating dog-mediated human rabies relies on a few core pillars. The absolute most effective strategy, by far, is the proactive mass vaccination of dog populations. It's a real game changer. You add to that strong animal control, widespread public education about prompt wound washing, and ensuring that people actually have timely access to PEP. We also use pre-exposure prophylaxis, which means vaccinating people before they're ever bitten, for high-risk groups like veterinarians, wildlife professionals, and animal handlers.
Ultimately, it all comes back to this one fundamental truth. Rabies is one of the deadliest infectious diseases, but it is almost entirely preventable. That beautifully sums up the whole paradox we've been exploring today. And it leaves us with this really empowering, evidence-based knowledge that science has already given us all the tools we need. Literally nobody has to die from this virus if the right actions are taken in time.
So, I'll leave you with this final provocative question to think about. Will public awareness and aggressive canine vaccination campaigns finally silence the ticking clock of rabies in our lifetime? The science absolutely says yes, but the execution? Well, that's up to us. Keep these life-saving protocols in mind, share this knowledge with your friends and family, and stay informed. Thanks so much for joining me for today's Explainer.